Hi, my dear students. So, our today's topic is Otalgia. We finished our Karnashula Lakshanas and treatment. So, Karnashula, that is pain in the ear. So, Otalgia is nothing but pain in the ear. So, we'll see what is Otalgia and what causes ear pain. Pain in the ear can be due to causes occurring locally in the ear or referred to it from remote areas. So, pain in the ear can be from the cause inside the ear or from the it can be referred from other parts near the ear. So, pain in the ear can be due to the cause occurring locally in the ear or from any referred pain from the remote areas or around the ear. The referred pain can come to ear. So, these both are called otalgia. Otalgia is nothing but pain in ear. Local causes for otalgia or ear pain. That first one is external ear. External ear comprises of this ear pinna and this external auditory meatus. So causes in this external ears are external ear pharyngal. Pharyngal is nothing but the boils or any abscess forming or in the hair, root of the hair, that is external ear pharyngal. So inside the ear, external auditory canal, you can see hairs, right? So on the base of these hair there will be a boil or an abscess, that is external ear pharyngal. Impacted wax. So wax will get impacted inside the external ear canal or external auditory meatus, and that will cause ear pain. And otitis externa, the infection or inflammation in the external ear canal. Otomycosis is this one, that is fungal infection. So you can see here like a bread mold, there is infection, small fungal growth inside the ear canal. This can also cause otalgia or ear pain. Meningitis bullosa, this is the condition. You can see small bullosas. This is bulb like thing. This is the ear canal. So you can see that is meningitis bullosa, one condition in the ear. Herpes zoster, that you know, and malignant neoplasms. So malignancy in any part of the external ear, these causes pain in the ear. So these are the causes for ear pain or otalgia in the external ear. So external ear pharyngal, a boil or any pharynglosis happen, that is in the hair root, anything comes in other parts of the body also, we will get pain like that inside the ear canal. If there is a pharyngal, the patient will complain of ear pain. And impacted wax, the ear canal is got obstructed with the ear wax, so that will also cause pain. Otitis externa, that is inflammation or infection in the ear canal, external ear canal. Otomycosis, it's a fungal infection affecting the external ear canal. This is the picture. So meningitis bullosa, this is meningitis bullosa. It is also a condition affecting the ear. There will be bubble like thing and a bulging of the tympanic membrane. Herpes zoster, that is herpes infection. Malignant neoplasms, and all the malignancy affecting the ear will cause external ear, can cause ear pain or otalgia. Next comes the diseases in the middle ear which will cause otalgia or ear pain. Middle ear acute otitis media. So acute otitis media is acute infection affecting the middle ear. Eustachian tube obstruction. As you all know, the middle ear is connected to the pharynx via eustachian tube. So any obstruction in the any end, the lower end or upper end of the eustachian tube, that is eustachian tube obstruction, that will also cause ear pain. Mastoiditis. Mastoid is the behind the ear, this structure, that is mastoid process. There mastoiditis infection that will affect this portion. After this middle ear and all, the mastoid process will also get that air space will also get inflamed, and it will cause mastoiditis. If mastoiditis is there also, you'll get a severe ear pain. Extradural abscess. Extradural abscess is the inflammation, the dura mater, that will also called extradural abscess. Abscess will cause pain. And aero-otitis media. Aero-otitis media is nothing but when we go to a higher altitude, there is a difference in atmospheric pressure and the middle ear pressure, and it will cause pain, and for afterwards it will cause an inflammation of the middle ear mucosa, and then there will be, it will leads to ear pain. That is aero-otitis media. A patient will come and complains when they'll travel in, some people will get that one ear pain while traveling in aeroplane and all. That is because of this one. That is mainly because of the pressure difference in atmospheric pressure and middle ear pressure. There is a difference in that too, and if you go to high altitude also, same thing will happen, and there will be an infection or inflammation in the middle ear, and that is known as aero-otitis media. And carcinoma of the middle ear, any cancer that affecting the middle ear. All this will cause otalgia or ear pain. So middle ear diseases are acute otitis media, severe pain will be there, eustachian tube obstruction. If you are having common cold also, there will be a chance for obstruction of the eustachian tube in the lower end, because of the nasal mucosa and all will get inflamed, and this lower end of the eustachian tube will also get inflamed, and there will be obstruction, and there will be pressure difference, and it will cause severe pain in the ear. Mastoiditis, the infection in the mastoid process. Extradural abscess is nothing but abscess formed in dura mater, and aero-otitis media is because of the difference in the pressure, atmospheric pressure and the middle ear pressure, there will be an inflammation in the middle ear mucosa, and that will cause aero-otitis media, and it will leads to pain in the ear. And carcinoma of the middle ear malignancy, that can also cause severe ear pain. So these are the local causes. So external ear and middle ear diseases that is causing severe pain in the ear, or otalgia. So next comes a referred pain. Referred pain. Initially we told, right, otalgia can be a local because of local cause or due to referred pain from other areas. So second one is, first one local cause we saw, external ear and middle ear, which all diseases can cause or which all diseases are having ear pain as a symptom. Next comes referred pain. Referred causes as ear receives nerve supply from fifth nerve, ninth nerve and 10th cranial nerve, and also from C2 and C3. So the same nerve supplying other parts, also there will be a referred pain to the ears. So the pain may be referred from these remote areas into the ears. So first one is via the fifth cranial nerve. So dental, from fifth cranial nerve, first one is dental. So carries tooth. Tooth carries, you know, right, cavity of the teeth. So the tooth teeth cavity can cause a referred pain to the ears. So if a patient comes, we have to check all those things. If ear pain is there, don't check only ear. We have to see the remote structures also. Sometimes the pain is from the teeth. So teeth, apical abscess. Apical abscess is a abscess in the apical region or in the gum region. So this is picture of apical abscess. Impacted molar, that some of you might have experienced that one, right? This molar will get impacted inside the gum. Malocclusion is a misalignment of the teeth. The teeth won't be properly aligned. So misalignment of the teeth is malocclusion. And that is about dental. These are the dental causes. That is via fifth cranial nerve. So dental causes are tooth caries, apical abscess, impacted molar teeth, or malocclusion, misaligned teeth. So these can cause referred pain towards the ear. So next comes the oral cavity. In oral cavity, any benign or malignant ulcer or lesions on the oral cavity or the tongue can cause a referred pain towards the ear. So if a patient comes with a earache, we have to check their oral cavity also. So we have to do oral cavity examination also. Next one is temporomandibular joint disorders. You know, this is the temporomandibular joint, right? This is mandible and this part is temporal. So this joint is known as temporomandibular joint. That bruxism is nothing but teeth grinding of teeth, or osteoarthritis of the temporomandibular joint, or recurrent dislocation of this joint, or ill-fitting denture. The denture what we are putting won't be proper. So ill-fitting dentures. These can also cause pain in the ear. So in the temporomandibular region, what all are the bruxism is the grinding teeth, and osteoarthritis, recurrent dislocation of the temporomandibular joint, and ill-fitting denture. The denture what we are putting is not proper for our teeth, then it will also cause pain towards the ear, otalgia. So these are the causes via the fifth cranial nerves. And also sphenopalatine neuralgia. Sphenopalatine neuralgia, you know, right? Pain, severe pain in the path, through the path of the nerve. So in the fifth nerve there will be sphenopalatine neuralgia. Sphenopalatine ganglions are there, sphenopalatine foramens are there, sphenopalatine arteries are there. So this is affecting the ganglions, sphenopalatine ganglions. So sphenopalatine neuralgia, it is also known as cluster headache. So it can also cause pain towards the ear. So these are the causes which is referred from fifth cranial nerve areas, so remote areas where the fifth cranial nerve supplies. So first one is then tooth. So dental causes. First one is caries, tooth caries, or apical abscess in the gum, or impacted molar, which is the molar teeth got impacted inside, or malocclusion, or that is nothing but the misalignment of the teeth. The teeth alignment was not proper. And oral cavity, any ulcer that is affecting the oral cavity or tongue, that will lead to a referred pain in the ear. In the temporomandibular joint, osteoarthritis or bruxism is teeth grinding, or a recurrent dislocation, or the denture which is we are keeping is not proper, then there will be a referred pain to the ear, and sphenopalatine neuralgia. So these are the causes. Next comes the via the ninth cranial nerve. So ninth cranial nerve supplies the oropharynx. Oropharynx is the area. You can see here, this is the oropharyngeal area. So acute tonsillitis, you know, right? These are the tonsils. So acute tonsillitis, inflammation of these things can cause to referred pain to the ears. Peritonsillar abscess. Peritonsillar means around the tonsil. Around the tonsil, if there is an abscess, that will also lead to referred pain to the ears. Tonsillectomy. Tonsillectomy is the removing of tonsils. And benign or malignant ulcers of soft palate. The benign or malignant ulcers in this is the soft palate area, and or tonsils and its pillars. This is the tonsil pillars are, this is the posterior tonsillar pillar, and this is the anterior tonsillar pillar. So any ulcer in this malignant or benign, or any abscess in these areas can cause a referred pain to the ears, or otalgia. So that is via ninth cranial nerve. And also any tuberculosis or malignancy in the base of this tongue also can cause a referred pain to ears. Elongated styloid process. Styloid process, you know, right? This is the styloid process in the temporal bone. There is a projection in the first year. In anatomy classes, you might have studied. So this temporal process, there is a process there is a structure. This is styloid process. More elongated styloid process can also cause pain in the ear. So, hope you understood this one. So, oropharynx, you know, there is tonsillitis or peritonsillar abscess. Around the tonsils there is abscess, or after the tonsillectomy there will be a referred pain, or any malignant or benign ulcer in the soft palate or the pillar area, and or in the tonsillar area will also cause. And also base of the tongue, if there is any tuberculosis or malignancy, that will also cause referred pain to the ears. And also elongated styloid process also can cause a referred ear pain. Next comes via 10th cranial nerve. So there is a malignancy or ulcerative lesion of valleculae, epiglottis, larynx or laryngopharynx or esophagus. So this is the root of the tongue, and here starts the larynx, and this is the oropharynx, and this is the esophagus. Okay, so epiglottis is right. That is a leaf-like structure which will cross the laryngeal part while we are having food, so that it won't go inside this and block our larynx. So air passage. So this is the structure which close when we are having the food, and when we breathe it will get open and the air will pass. So that is epiglottis, and this dip is known as valleculae. So malignancy or any ulcerative lesions in these structures, that is valleculae, epiglottis, pharynx or esophageal area, then that will also cause a ruffled pain towards the ear. Via C1 and C2, C1 and cervical, C1 and C2 spinal nerves. There will be, if there is cervical spondylosis, injury of the cervical spine or caries spine. Caries spine is like dental caries only, a small portion of deterioration in the small like pieces, small disintegrate as small pieces in the spine. So that is spine caries or caries of spine. So these can also cause a pain, ruffled pain towards the ear. So via the 10th nerve is any malignant or ulcerative lesions in the valleculae, this area, or epiglottis or larynx or esophagus can cause ruffled pain towards the ear. And C2 and C3, if there is cervical spondylosis or injuries of the cervical spine or any caries in the spine, cervical spine, then it will cause a ruffled pain towards the ears. These are the this picture shows the ruffled pain seen in the ear. So overall, this is C1, C2, C3 from the cervical spine, and fifth nerve. From fifth nerve, this is temporomandibular joint, tongue, and then that causes fifth nerve. So these can cause ruffled pain in the ear. And in this picture, with ninth nerve from the tongue and our oropharyngeal area, or base of the tongue area. So there is soft palate, tonsil, tonsillar pillars, any disease or any ulcer in this can also cause ruffled pain towards the ear. And 10th nerve from the epiglottis, larynx, pharynx and oropharynx, from there any ulcer is there, that will cause ruffled pain towards the ear. So these are the pictorial representation. Ruffled cause of otalgia. Next comes psychogenic cause, psychogenic ear pain. So when no cause has been discovered, then pain may be functional in origin, but the patient should be kept under observation with periodic re-evaluation. So if no cause is found or discovered, so the pain may be functional in origin, but the patient, we have to keep the patient in observation to re-evaluate the condition. Otalgia is a symptom. So otalgia or ear pain is a symptom with the other diseases. So it is essential to find its cause before specific treatment can be instituted. So before giving a treatment, so we have to find out the cause for the otalgia. So in this this section, we are giving importance to the causes for ear pain, because it is a symptom. So we have to first find out what causes the ear pain, and we have to give treatment. So that's about otalgia. I hope you understood otalgia or ear pain. So ear pain can be due to local cause or a ruffled pain, or due to psychogenic causes also. So otalgia is a symptom. So we have to find out the cause, and then we have to give the treatments. Thank you.